I choose to do psychiatric nursing in TUS just because the mental health field had really interested me. In recent years, it had become a real talking point for people. People were talking about their mental health, minding their mental health, how to maintain it. So I suppose I always wanted to do nursing, but then when I found out that there was a specific nursing to do with mental health and caring for mental health needs, I went for that. Something I really enjoy about studying in TUS is the blended learning approach that lecturers and module leaders take to teaching. So as you can see here, we are in a suite that simulates a hospital ward. And this is brilliant. When we are down in our lectures, we are learning theoretically how to care for someone and then to come up here and practice the skills in a practical sense. An example of this blended learning is the skill of venipuncture, which is taking blood, that we learned earlier this year. We learned how to take blood from some of the mannequins, and then we got signed off on this skill and we went out to clinical placement to practice this. I think this blended learning approach is really helpful in getting a feel for the real workforce of nursing. The clinical placement is also a huge part of our learning, so we may learn how to give skills up here. For example, giving an injection, we may learn this up in the wards, and then we will go out on clinical placement and bridge that theory to placement gap and complete this on clinical placement.